Good evening, colleagues, friends. Let's make a start. It's my pleasure to share some personal experience and some knowledge with you on managing complaints. Um, we'll continue to conduct and organize similar talks in the coming future, and we want to make it useful and relevant to your interest, particularly related to healthcare or health services management. So good evening again. Now, how are we going to manage complaints by professional customer service? I select 3 areas to share with you with some um, basic issues, principles, as well as some case sharing. Oh, I forgot to introduce myself in case if any one of you do not know me. I'm Ben Fong, and I'm the program leader of the Masters of Science in Health Services Management. We'll talk about quality and safety in healthcare services, professional ethics, customer and community expectations. First of all, why do people complain? I'm sure everyone would have complained for anything, major or small, or some very minor issues. And in some cases, we don't have a reason. We just complain. But then company can find that if the person or the family are not happy with some services or not happy with anything they see or hear, they might make a complaint. And as we know, Hong Kong is a very open, transparent, and accommodating society. So we allow people to complain, either formally, informally, or quietly, or even secretly. Another common reason for complaint is there's a gap in services, meaning the expectation is not being met, or the service has not lived up to the um, expectation or people's perception of the services. And of course, at times is initiated by some incidents, whether it's nasty, intended or unintended, or even accidents. Perceived quality is also a common reason for complaint. When you expect something to be provided in a certain standard or the way you wish, and when it's not happening, we may make a complaint. And of course, I just mentioned that it can come out of nowhere because people are frustrated or they are not satisfied with some services or items that they purchase, and they will make a complaint. And there are people who would like to draw attention, either within a group, in an organization, or even in the public. They make complaints very loud and clear to draw attention. And of course, there are also complaints arising from person's personality, or it might be a cultural norm. Uh, I don't want to point my fingers to any particular cultures or ethnic groups, but I'm sure from everyone's personal experience, they'll find that some people are more likely to make complaints. Uh, and mostly are not with bad intention. You just maybe it's part of the way to communicate with others. They make complaints so that um, they make it a case. And of course, people seeking sympathy or understanding from the society, from the providers or organizations might also make complaint. So overall, essentially, complaint is very much like making a noise, making a point, and drawing other people's attention. Before I continue, I'd like to share with you a couple of cases where people make complaint. Now, people may make complaint when they see the bill, whether it's in a clinic service or in the hospital. They might not expect to pay uh, a certain amount, and they may initially argue with the frontline staff, and subsequently they may make a complaint. And people may complain because of some complications from medication or from procedures like uh, a swelling from the injection point and so on, or infection. They all often make complaints. Okay. Now, to handle complaints is really an art. And very often we learn from cases, we learn from experiences. But essentially, we need to have a certain personality in handling complaints. We cannot be confrontative. We cannot be too reactive. So the key message is to stay calm and be very, very smart and try not to say too much unless you really know what to say. But equally, we cannot keep quiet all the time. Otherwise, the other party might think that you are not care. You're not caring. You don't care about what's happening. So in my first selected uh, uh, sharing is to deal with complaints with quality and safety in healthcare service. Now, by doing so, we enhance the patient outcomes or the service outcomes. We improve satisfaction and promote the overall public health or population health. And by doing so, with the emphasis of quality and safety, we ensure the effective, efficient, and safe care and services. And that will avoid potential complaints, as I mentioned initially, people are not satisfied with the service or the quality, they will make complaint. And if the service is timely, and of course, in the public health perspective, we talk about equity. Everyone has the equal access or equal opportunity to services, then they don't make complaint. Say, when we are waiting for a consultation, whether it's in the public or private clinics, when they are busy, people might lose their patience and then start to complain. But if we make the appointments uh, in a better arrangement, uh, avoiding people to wait for too long, then they might not make complaint. And of course, we always promote people-centered care because they are the person we really care for. And in the private sector, these people, or sometimes we call them customers, are the ones who support and pay for the services. Or in other words, they are our bosses. So if we provide the care with dignity, respect, and compassion, then complaints can be avoided or at least uh, reduced. And of course, error reduction is very important. We don't want to make any mistakes in all kinds of patient care or services or procedures. And a key message is to do things right the first time. If we have to redo any procedures, potentially that can be a disaster, let alone complaints. And of course, infection control, and we are very familiar with um, since the COVID-19 pandemic. And I'm sure everybody is very vigilant about avoiding infections. And at times, such incidents may develop into crisis within organizations or facilities, including clinics and hospitals. And that will also draw complaints. I suppose colleagues still very fresh in your memory that I think it was the fifth wave of the pandemic. People were waiting for hours or even days to get into the A&E department of a couple of public hospitals. And certainly the complaints didn't only come from the patients, their families, but from the public. So that will draw complaints. And of course, if an organization has the culture of safety for their clients as well as the staff. Now, I really want to make a specific emphasis on staff. We cannot just take note of what our clients or our customers would have to say or would expect. We must look after our staff, and this is very essential. They are the bone, they are the backbone of our organizations and services. And of course, a safety environment is essential. Uh, and the uh, legislation or ordinance to license private healthcare facilities has a very strong emphasis on safety. of the facility. And of course, staff training and competence in quality and safety will help to reduce. Now, take note that I did not use the word stop or avoid. It's reduction. To reduce errors, to reduce incidents or accidents. And that will reduce the number and frequency of complaints. And now I'd like to draw your attention. This is a bit of advertisement on our program related to quality and safety in healthcare services. We do have at least 4 subjects concerning this area. We have a subject of quality assurance and safety in healthcare management, healthcare facility and operations management, project and human resources management, and crisis and disaster management in our program to provide knowledge sharing as well as case study in quality and safety in healthcare services. Now, the second part is on professional ethics. I always tell my students that if we are not concerned about quality or ethics, we should not be here, meaning we should not be in healthcare. Because we are dealing with humans, we are dealing with human life, we are dealing with humans' health and wellness. We are not dealing with objects, we are not dealing with machines. So it's more than essential. It's our core in upholding the highest professional standards and ethics. So we should build professional ethics or ethical practices into the company objectives as well as the organizational culture so that every staff, new or old, are always in the mindset of ethical approaches, ethical services, and doing the right thing and upholding the highest standard, as if they themselves are the recipient of the services. Now, in Cantonese, we always say that 易地而處. If you accept the kind of care or service that you are providing to others, then I don't have anything to say. But if you have second thought, then you better think again how to do it in the proper manner. Okay? Recently, I was attending a public clinic to have a blood test. When I walked into the room, the 2 ladies were chatting to each other. While they were so meticulous and careful in checking my ID, my name, and requesting me to say my name, Fong Yuk Fai, your ID, E so and so and so, while they were talking to each other. And that's dangerous. That's really, really dangerous. Okay? How could they split their attention? And they are doing a very, very, very highly demanding procedure in terms of accuracy of the person, the accuracy of the tests to perform, the accuracy of the right bottles to use, and so on. And this is totally unacceptable. All right? And that's what I meant by ethics. And that potentially will invite complaint. Of course, I did not do it because I don't want to expose my identity and make a noise. But I'm sure some people might make complaint, either on the spot or whatever. Now, it is also a fundamental principle to emphasize on professional ethics in guiding our staff, all staff, whether they are at the senior level, professional category, or even the front line. Take a very simple example. I always say that all staffs are equally important to the management, to the hospital, to the clinic, because even a frontline cleaner is performing a very important role. If they do not do it properly, given time, we're faced with at least two consequences, either untidiness or unclean environment, or potentially with infectious risk if they don't do it right. So it is important that every staff, particularly the newly joined staff, they should be not only told, but they should be make it very, very clear message to them that they must do the right thing, do the right job, and do it properly. And that includes the contractors. I don't think that the contractors, okay, I contract it out. If anything happens, it's not my concern. No, that's not true. It's the other way around. When the contractors finish their job, then who's responsible for the consequences? It's the organization, the senior management. All right. So we also have to ensure services are delivered with integrity, respect to people, as well as our own staff, and accountability. And of course, I don't need to say too much about confidentiality as an ethical issue. Integrity meaning honesty, transparency, treatment options being available to people, and and in the private sector, we must let people know how much they expect to be charged, and this is very important. And in terms of professional competence, we must have an ongoing and effective CPD program, including CME, CNE, and skill development for our staff. Now, when we encounter ethical dilemmas, end-of-life issues, etc., there must be some more than standard procedures to deal with them. And the management may need to be involved in some particular cases. And in terms of resource allocation, whether in the global perspective or within organizations, we must take care of the potential crisis, unusual situations, and restructuring, meaning we should not just allocate funding for the usual operational needs. There must be some reserve, if you like to use that term, or at least some attention to provide for unforeseeable situation, which can happen all the time. Even a uh, uh, minor electricity shutdown or whatever. Okay. On the professional ethics, we do have subjects like laws and ethics in healthcare, quality assurance and safety in healthcare management. I already mentioned, and leadership is very important. Strategic management. So we have the advanced leadership and strategic management in healthcare. Healthcare economics, particularly related to resource allocation, as well as project and human resources management. The last sharing is on customer and community expectations, and this is uh, bringing home the manage, management of complaints. Now, commonly, we always say that is the customer services personnel or department should be dealing with complaints. But in the real world, this might not work unless it's a very minor complaint. And before I go on, I'd like to share with you a rather sad story, potentially will create complaints or even public attention. And that was soon after the new hospital was established. We had a nasty uh, post-delivery incident. I won't go into the details, but the young mother did not survive. It's a loss to the family, to the young couple, and it was very sad. So we had to deal with the case in terms of how to help the father, the family to face with such an unexpected incident with the loss of a life. And our approach was very straightforward. We not only comfort the family and the father, but we will we build the trust with the family so that they were willing to voice out their concerns, their unhappiness, and other issues surrounding the incident. And internally, not only um, the senior management led by me had to communicate very closely with our staff because some of them had very bad feeling and they felt that if they didn't do this, that might not happen and so on. So it wasn't an easy situation to deal with, but time was very, very important. We could not spare much time. We need to act fast. And to cut the story short, we managed to not only build the trust with the family, we also gained the understanding that we would do our best in whatever manner as possible to help them, to support them. That includes waiving the charge, and we also talk to the responsible specialist to do the same. And we had the head nurse communicating with the family at least daily and more frequently in the initial week. So given time, we managed to solve it. So it is very important. It's an art. And I don't think there's any uh, rule, hard and fast rule to say you have to do step 1, 2, 3, 4. We have to be tailor-made, if I can use the word, in dealing with individual cases or situations. Now, of course, to reduce complaint, or if this time I can use the word avoid, is to make sure that we always provide quality care to our recipients or our clients, to make sure that they are satisfied. And the service or care must be courteous, meaning our staff, particularly those in the front line, should be polite, soft-spoken, and presentable. And it makes a difference. Just like the two staff in the blood taking clinic, if they are nice, I don't think I would feel uncomfortable, right? And of course, in the private sector, we like people to think that it's value for money. Although at times we charge them a high rate, I don't think people may not mind if you tell them that it's going to charge that much. But then after the service, if they think that it's worth it, then that's value for money. It's not the mere number. It's really the approach and the quality that they perceive. And access to service, and this is not only important in the private sector, it should be also be managed much better in the public hospitals. Now, personally, I consider that this is possible because when we go to different public hospitals, you see the difference. Now, people always say that you wait for an hour or so, the doctor will see you for 5 to 10 minutes, and then you wait for another 2 hours for the medication. But in some hospitals, it does not happen. Why? It's not because they have fewer patients. It's also full house. It's a system, all right? And transparency and communication, this is essential wherever you go. And I don't think this is only applied to healthcare. It applies to everywhere, even within the university. We cannot hide things from people, and we should not. Okay? We do things right. We should be open. Personalized care, and I'm sure this is everybody's wish. Everybody's wish. And as I said earlier on, in healthcare, we're dealing with people, we're dealing with life, and we're dealing with health. And that should be personalized. And we often say 人性化. This is extremely important. So I would like to see a wide application of case management. In fact, in the medical discipline, we always say that family doctors are the case managers, and nurses are also in the best position being case managers, particularly in the public sector and in hospitals, because we always like to talk to people you know and trust. Now, take a very common example. Colleagues at my age, we like to go out to yum cha. And if you know the manager or the 部長, you feel more comfortable. And that's case management, right? So it's something that we can not only explore, I'm sure we explored a lot already. We should promote it and make it a service-wide management or structure. And of course, coordination is the same. Now, another important thing is to engage people, empower them, and involve them. And this is the wish of the government in promoting primary health care. Another important area is safety and privacy. This is also very, very important. Technology integration will also help to increase or enhance our customer service and reduce the gap in the community's expectations. And of course, ethical practices, I already mentioned a lot. What do we provide in our course? We have the marketing and management for entrepreneurs. We have the healthcare facility and operations management. And we have the quality assurance and safety in healthcare management. And we have the advanced leadership and strategic management in healthcare, and ESG in healthcare, AI and digital health. So although some subjects are repeated, but they are there because in our course, we have 6 compulsory subjects and candidates can choose 4 electives among another 6 or 7. So lastly, I like to give colleagues a few take-home messages. We must be patient in resolving complaints and differences, as I illustrated in the very sad incident many years ago. And we must maintain a good dialogue, which means it's more than communication. It's not simply talking to them. We must build a dialogue, meaning trust and respect, mutual understanding, etc. We should have all the time happy and satisfied staff, then the users will also be happy. And this is very true. Until our own staff are happy and satisfied, then they will provide the best possible and quality service to the clients. And we also like lifelong customers who build a very lasting relationship, trust, and they will come back all the time. And these customers will also refer other customers, their friends, their family, relatives to your clinic or organization. And commonly we say is through the word of mouth. An organizational culture of customer service, and that includes ethical quality services and image and brand building. Last time in my talk, I shared with colleagues about how I built New Union Hospital so fast and to make it a name, at least in Hong Kong and in Guangdong province, is branding, branding. And we make use of souvenirs and an eye-catching logo. And even now, 30 years after Union Hospital was opened, every staff wears the logo pin at work, every staff. I'm very glad that my successor continued this practice. And a few years ago, our graduate started at Union Hospital, and she sent me a photograph of the logo pin. She said, "I'm very happy I got this pin." It's kind of not only imaging building, but also something to hold every staff together, to give them an identity. They're proud of being part of it. So unless our own staff are happy and to be proud of our organization, then they would provide very good service, and that builds the branding. It's not through advertisement, that's only part of it. But essentially, we have to do the core thing and build a very important image of your organization. And of course, marketing strategies are very important. And Union was the first hospital in Hong Kong to have a marketing department. And at that time, I was arguing with our mother company. They told me that, well, we are selling properties, we need marketing. But then you have a hospital, people will come to you. I said, no. I said, unless we let people know what we offer, what services we provide, they will not come. Particularly a hospital built and owned by a property development company. It's not a medical company. Okay? So, and I was very quick to get the Faculty of Medicine of the Chinese University of Hong Kong to be our partner. And of course, that through some personal relationship with Professor Arthur Lee, who was the dean at the time. And he is also a family friend of our boss, Mr. Lee Shoki. So that is a strategy. And it worked for both parties because Chinese U would like to have a private hospital that they can affiliate with. And we need their support and their backup professionally. Now, in marketing, we like to tell stories, but remember, this is very important. These days, some marketing strategies are wrong and not trustworthy. We must have true storytelling. We should not have those fake persons or actors to play the role. We cannot convince people. All right, I remember years back when the hospital authority was first set up, they had all these big poster advertisements in the MTR. And they employ actors. And later on, people say, oh, they are not real nurses. How can you have such unreal persons? All right? So it's very important. And marketing is not simply selling services or joint business, but is building trust with the public, with the community. That's about all I would like to share with colleagues. And I would uh, just remind colleagues, if you are interested in our program, we do have entrance requirements. So essentially, applicants or candidates are expected to have a recognized bachelor's degree or equivalent qualification in healthcare, social and related services, and of course, will consider individual cases if they do not hold a bachelor's degree or do not come from the healthcare sector. We are very open because from our experience in other courses, particularly in the top-up degree I have managed and led for the last 10 years, we do have students coming from different or diversified backgrounds, and they really do well after they shift to the healthcare discipline. And for non-degree applicants, but then if they have professional recognition or work experience at the supervisory level in healthcare, social and related services of 5 years standing, will also be considered for admission. And of course, English is our teaching medium. And if the degree is not from a course taught in English, will require a scores of 6 of the IELTS test, International English Language Test System, or a score of 80 from TOEFL or some other recognized English language assessment.